Every Indian founder dreams of going global. But where does that journey start? In this episode of NXT Health Commune, Dr. Anuj Gupta, public policy and transformation expert, currently supporting the restructuring of NHCC at the Ministry of Health, Saudi Arabia, shares what it really takes for Indian startups to build credibility, scale with purpose, and go truly global. Dr. Anuj, thank you so much. I know this is just before Diwali, everybody is on holiday because we are working, and I think it's the right time for me to talk to you. NXT Health podcast, what we are trying to do is to have conversations with ideas, ecosystems, healthcare, infrastructure. My co-founder, Dr. Kavya, she talks to the startups. I talk to the start advisors, mentors, those who can help the startups to shape up in a way that is required for patients. End of the day, we all are working for people and patients, right, in healthcare.
Yeah.
And thank you so much that you agreed that we should have this conversation. So it's a pleasure to have you on the show. Welcome on the show.
My pleasure. Thank you so much for having me here, and I really look forward to the to our discussion today.
Perfect. And before we get into all this bigger question, the elephant that we are answering, can you quickly help people, those who are listening, your journey? Today, you are helping Ministry of Health in Saudi Arabia to shape up the policies. Okay, but where exactly it started? You are from core medical background. You are a dentist, and then you have traveled so
Yes.
much. So quickly, if you can tell your journey, that will help us.
Sure. Thank you so much. So my journey really, if I have to summarize in four key words, it is an intersection of patient well-being, technology, healthcare as a business or operations, and human impact.
Mhm.
I started my journey, as you rightly said, as a clinician, being a dentist, working in hospitals and across clinics, back in 2005 to 2008, and then something struck me really well. Back then, even at that stage, I would say our healthcare system was evolving, was in pretty nascent stage, and I could see the buzzwords coming in: technology, transformation. But what was the technology and what was the transformation, and what and where we were aiming for? That direction, that clarity of our north star was not there, and that's what
Mhm.
enticed me to move into management consulting. First I did somewhere around good 10 years into operational consulting and strategy consulting for healthcare providers across the world. I advised companies from Fortune 500 across US and Europe, and then after spending almost 7 to 8 years with clients across the world, I felt that this is the knowledge that we need for that transformation. We need that clarity, and probably my experience with them can help bring that knowledge back to India. So I
Mhm.
started focusing on India more, and that's where we that was the period of 2017-18. We were starting to hear about EMR implementation and rollout.
Mhm.
Till that time, unfortunately, India was just talking about digitizing patient record and not digital transformation. But
Mhm.
ever since that, I think the flair in the market for tech and the appetite to ingest tech has grown considerably well,
Mhm.
and we have seen some mega transformations across different systems. So if you look at India is a very interesting geography. We have 70 to 80% of private healthcare contribution in healthcare delivery, and government spends around about 20-22%, which is unfortunate, but yes, that is the dynamics that we work on.
Yes.
And these private healthcare providers have been the central driving force for healthcare transformation, which also led to our own system. In over the last decade, our own system has created so many digital IPs, which have helped healthcare a lot. And I think
Mhm.
in next 10 years, we will see our system evolve a lot from what it is today.
Mhm.
And that's the change, exactly what transpired to me to go further and explore how I can help into this transformation. I went to Oxford, did my MSc again in
Mhm.
global healthcare leadership to understand where is the gap between global versus local. we are very proud of made in India, but our attitude needs to be made for global.
Mm.
Origin is important, but making it at a global level or solving a global issue is also very important.
Yeah.
And that's where this degree helped. And after that, I got this opportunity to work as a SME in digital transformation and operational excellence
Mm-hmm.
for public policy frameworks in Ministry of Health for Saudi government.
Mm-hmm.
And that's the role, and that's the part till now. And
Mm-hmm.
hopefully, I'll continue on this further.
Yeah, like whatever is your experience and your journey, now actually it's putting all together to build the policies for this largest global transformation.
Yes.
It's like a synonym of transformation if you look at it the way they are planning to put these things together. But I'm coming back to India. Okay, I'm a little biased for where I am right now, and I am
Definitely. So
speaking
am I.
on yeah, Hannah, and that's why
Right.
we are here. I'm speaking on behalf of the startups. I work with good startup companies. uh,
Mhm.
they have potential. You know that the Indian techies have potential. Whether
Right.
the tech support or we are talking about the leadership globally, all the techies that they are leading such a large organizations, and we see that. But how many Indian tech companies are able to create a global impact? Now, how do you think? Like where exactly in this last 10 years of your experience is it evolving? Is it changing? Anything that you see the transformation that is happening in the ecosystem?
Oh, yes. I mean, India has come miles, and this transformation was not expected.
Hmm.
Honestly, if you talk to me about 2015 and 16, probably I would have never imagined that we would be anywhere close to integrating patient data, creating interoperability across systems. Using Aadhaar or phone numbers
Yeah.
as unique patient ID, and then building solutions around it, and not just integrating the data or providing access to the data, but also building solutions around it, the kind of
Mm.
solutions that we are talking about now. But see, the problem right now in Indian ecosystem is that we are still miles apart from product mindset. Our
Correct.
culture, our education kind of creates a bias towards operational management, and that's what we are good at. Even
Okay.
in your question, you kind of answered that Indians are leading, but Indians are
Mm.
not creating.
Creating.
That's
Okay.
the gap. That's the
Okay.
difference
Okay.
between global. So there are a couple of cultural challenges we have. There are a couple of political and geographical challenges that we
Mm.
have. First of all, whenever I talk to a lot of startups,
Mm.
in my day-to-day job, and one of the key elements is that India is a big market. Everyone perceives that, but really think about it. Our per capita healthcare expenditure is one of the lowest. It's around about 60 to
Mm.
65 USD. We
Yeah.
spend around about 4% of our disposable household income on healthcare. So, are we a real big market? That is the critical question
Mm.
that everyone should be answering. Our appetite to
Mm.
spend on healthcare solutions is very much limited to a very narrow pool within this large pool of society that we belong to.
Mhm.
And thinking about creating a universal solution for India, I think it is a bit far-fetched right now at the current state we are in. Yes, in next 10
Mhm.
years, everyone will be part of healthcare journey, and everyone will become the part of the so-called funnel, healthcare funnel.
Mm.
But it is still miles apart. So
Okay.
if we have to talk about global solutions, we
Mm.
really need to go when we are doing the problem definition, when we are sitting down as startups and we are trying to construct a solution or find a solution or find a problem to solve for. We really need to look at that, does this problem really percolates or goes up to the global level or not,
Okay.
and we have to be very critical about it.
Correct. Are you saying that the gap that exists is because we focus on leading and not creating? Is that what you are,
Yes, yes,
saying?
exactly.
Okay. Mm-hmm.
So, and in fact, if you look at the startup reports, most of the Indian solutions are again service oriented
Mm.
solutions, and
Correct.
they are nearly similar to what global has. I mean, there is a strong element of me too. I mean, I don't
mm,
want to
mm,
be sarcastic or critical of the solutions. Yes, there is
mm,
innovation. I'm not denying that. But
mm.
on the larger side, there are many me too solutions that we try to take out from Indian bucket and try to put in on the global bucket. But see, the
Okay.
problem is that the solutions in any shape or form, or
Mm,
in near similar shape or form, do exist at the
mhm.
global level. So how do you create a space out of it yourself?
Correct.
Look at
Mhm.
Silicon Valley. What is the key difference between Silicon Valley and an Indian tech ecosystem?
Mm,
It's the incubation facilities, incubation ecosystem, the support that Silicon Valley startups they get the kind of regulatory framework they have,
mm,
the kind of access that has to be generated. So it's both. I mean, if you break it down, it is actually a mixed bag of our own mindset and our
mm,
own cultural and societal ecosystem that needs to change if we
mhm.
have to play big on the global platform.
Okay. But then, before we get into like each problem statement, okay, is it our mindset? Is it our investment system? Is it our incubation approach? Is it our, the service industry success, if we say?
Yeah.
We'll go into each sector, but before that, you said about this thing is like a global company, okay? So when you say, assume that I'm talking to some startup, or if I am a startup, what's the global company? Is it not just the technology, or how do you define it?
For me, I will be very straightforward with you. For
Hmm.
me, global company is not the footprint.
Hmm.
It's the value creation. So
Hmm.
is your solution creating a value for problem which is
Hmm.
global in nature? Is it solving that universal problem in particular?
Yeah.
And then, there are some attributes which are attached to this particular statement. Say, for example, global compliance is there, governance standards are there. Once we have thought of a problem and a solution, we also need to understand that there is a mixed bag of attributes which we need to solve for once we say that we are
Hmm.
going global. And then one of the critical elements, and specifically in context of Saudi, I would say, is the
Hmm.
cultural difference.
Hmm.
Is my solution culturally compliant with other geographies? For geographies like Saudi, for
Hmm.
geographies like Africa, I mean,
Hmm.
be it DRC, the Congo, Egypt,
Yeah.
Nigeria, these countries, these geographies are very culturally sensitive.
Hmm.
They have their own strong cultural value. Do we address those in our solution? So
Okay.
that's the mixed bag. You bring in compliance, you bring in culture, and then you draft a solution which is solving a universal problem.
Yeah.
That's when you become global.
Correct, correct. Oh, so beautiful. But tell me one thing. See, I'm a doctor, right? You're a doctor.
Yeah.
When we study medicine, when we study physiology, anatomy, it's the same thing. Okay, when I give the paracetamol to some Marathi manus versus if I give it to a German guy who's like probably 7 feet or something like that, the fever will go down. Science works exactly the same. Science is neutral, unbiased. And when we are creating technology solution for the healthcare, okay, it should be neutral, it should be unbiased, right? If I am creating something for some human being or some disease population in my country over here, it should be applicable to the other country. It should work like a science. But then is it because when we look at, you said about the value, right? Then where is that gap? Because I am creating for something that is applicable to everyone.
Gap is conviction. As simple as
Hmm.
that.
Yeah.
So paracetamol, branded by, say, no, an Indian pharmaceutical company, I don't want to take a name, and printed in English with the dose and everything,
Hmm.
versus a medicine which is, say, an international global pharmaceutical company, but printed in Arabic with
Hmm.
all the information, the
Yeah.
leaflet
Okay.
that you have. So all that
Uh,
information in Arabic, which
yeah.
is more convincing for anyone, say, sitting in Saudi.
Of course.
The,
It's in
the
Arabic. Yeah.
the difference is the culture. You have to customize
Okay.
when you are approaching global markets. You
Huh.
have to think from their perspective, not from your perspective. How
Perfect.
does your solution sits into that? And
Uh-huh.
then creating that conviction based on evidence. That is the
Mm-hmm.
second layer of conviction.
Correct.
You can give paracetamol, achieve efficacy and effectiveness results in
Hmm.
Indian population, bring that data to anywhere, but no one would heed to it because
Yeah.
everyone is doing that, right? Everyone
Hmm.
is taking their own data and telling that this works.
Correct.
But
Huh.
what the consumer needs to understand is whether it works on your own, in their own scenario, in their own
Hmm.
market.
Hmm. Hmm.
And that's where you need to have these data backed evidences or an academic research with
Yeah.
a local university, local hospital proving that your
Yeah.
solution is
Yeah.
effective.
Yeah.
The implications are multifolds in that.
Correct. Correct.
There that's where you create the conviction. So the
Correct.
simple answer is conviction.
Yes, but isn't it funny? Like, see, you studied in India, you worked in India as well. Here, especially, our doctors community, and I can speak on their
Right.
behalf, even if I'm criticizing them. I'm one of them. Is if a study is published in a journal with a good impact factor, it's an international journal, we call it a value. Whereas if the same study, which is applicable only for Indian population, only for applicable for Indian doctors to take this and add it into their treatment protocol or management, we do not call it a value. Now, is it not the different mindset altogether? Like when I'm sitting in
Yes, it
India.
is. It's unfortunate, but
Hmm.
it is the global reality. It is the soft
Hmm.
power.
Yeah.
We ourselves have let gone the credibility of our own systems, and this is very unfortunate. I'll give you a very straight example. When I went to
Hmm.
Oxford, I still remember my first module. When I completed my first module there, I was
Hmm.
asked to write a paper,
Hmm.
and if I had not been part of management consulting journey and written some thought leadership pieces, I had no idea about how to write a research paper,
Hmm.
and
Hmm.
that's unfortunate. And that's where I was talking earlier as well. Our system is designed to educate us on operating. I mean, running the
Yeah.
operations,
Wow.
but
Huh.
not looking beyond that.
Correct.
And
Correct. Correct. Huh.
I've seen, I mean, I met so many people globally across universities, across different debates, different platforms, wherein
Hmm.
Indians, when they have gone outside, they have taken a foreign education, they have just broken their limitations. They have just gone and did
Hmm.
things that they never imagined while in India. So that's the critical
Yeah.
question we need to ask ourselves out. Why do
Correct. Correct.
we,
Correct.
why are we restricted when we are in an Indian scenario? Why Satya Nadella or Sundar Pichai needed to go to the US to prove their
Hmm.
worth?
Hmm.
Why couldn't they prove it
Correct.
from the Indian subcontinent? And that's, if we can address that, I think, we will start building our credibility. I mean, the world will start acknowledging us that, it already acknowledges us,
Hmm.
but the only
Yes.
fact is
Hmm.
that we need to create those power centers within Indian subcontinent that people
Yeah.
like you and me can use and exhibit that yes, we announce ourselves on the world platform.
Correct. See, look at this. Like our Indian companies, are we too focused on creating solution for us? And I find it is fair, even if it is so. Unless if a startup owner says that I am building a solution and tomorrow I want to acquire market, like I want to acquire US market or Middle East market. If they say so, then it's a different scenario. But is it that we talk about those things because it's required to speak that I'm going to do the market expansion and other things? But are we just too focused on our own problems and we look at only our problem and create for our solutions and then we expect the world to just implement it?
See, yes, so this is a classical trade problem,
Hmm.
trade problem, I would say. So first of all, the problem is not when we say that we are going to build a solution for the Indian market. Indian market is
Hmm.
pretty big. Even if
Hmm.
I say that, say we discount the 80% of the population which probably will only consume healthcare when it is an emergency, still the
Hmm.
20% is large enough to cover most of the Europe. So we
Hmm. Hmm.
are big consumers of healthcare, and it is
Yeah.
pretty fair that we are doing a solution for this big large population chunk. Where the problem begins is when we say that India is a beta market, that we
Hmm.
will
Hmm.
develop
Hmm.
the solution in India because it is cost effective, labor is cheap, there is availability of skill and talent. Let's acquire, let's develop the solution here, and then take it to the world without thinking
Wow.
that whether world requires it or not.
Hmm. Hmm.
So
Hmm. Hmm.
that is
Hmm.
the biggest
Interesting.
challenge in Indian trade. You know,
Yeah.
entrepreneurs startup or innovators need to understand that if you have a global perspective, think global on day zero. Don't think
Yeah.
global once you have expanded in Indian market, because by that time your product, there would be a better version of the product available on the global
Somewhere
platform.
else.
So
Yes. Yes.
yeah, and they would have the credibility, they would have the support of the government. I mean, government in India, I would not say that startups in India do not have support of the government. They do have that support, but
Mm-hmm.
again, the access that somebody in the US will get is just phenomenal. I mean, it's not,
Mm-hmm.
an Indian startup cannot even imagine
Yeah.
the market access, the credibility, the willingness of international markets to accept a solution from coming from
Mm-hmm.
US or say European country. And then there is some part of element which we can also talk about, where we can point fingers towards our academic institute. We have
Mm-hmm.
to come out of the love for IIMs and IITs. They are
Mm-hmm.
very good institutes, very, very, and they have contributed enormously. But yes, there is a world which has, now there are Indians which have gone outside, learned, and came back. Start
Mm-hmm.
acknowledging them. Start
Yeah.
acknowledging that diaspora. They are creating value and they will continue to create value. So,
True. True.
but the larger part, as I said, is solving and creating a product for global, and not thinking that it is a beta test market and I will test my market product here and then take it global, would not work like that.
Oh,
Definitely would not work like that.
what an amazing thing that you said.
See, healthcare solutions cannot be developed without physicians.
Hmm.
I'll tell you one classical example. So I was talking to this partner who was starting from a big four. She was based out of the US, and she had a team in India, Kerala in particular, and she was developing an ER solution, calling it as AI, and wanted me to have a review of whether the solution is worth investing more and taking it to the market and all that blah blah
Hmm.
things. So, when I looked at what the solution did was that it informed your ER department when a patient is registered in ambulance. So,
Okay.
emergency has happened. The paramedics have reached. The
Hmm.
paramedics raise a ticket, and the ticket is automatically flagged at the ER, and
Hmm.
ER knows whether it is a trauma case, whether it is a CVD case, whether it is a head injury case, or whatever
Hmm.
case
Hmm.
it is.
Hmm.
That's the AI automation that,
Okay.
and that's my problem. You
Hmm.
don't think. I mean, bring in a doctor, they will tell you that this is very basic and this already happens.
Yeah.
So in some form or the other, or probably paramedic picking up a phone and calling the ER, telling
Correct.
that we are bringing in the patient. This is already happening. So why do
Yes.
you need
AI
another
for that.
layer of tech? And think
Hmm.
now, if you think systematically, and that's the second critical element that whenever I look at pitch decks or solutions, the systemic thinking is not there.
Hmm.
This is a classical case of it. You know,
Hmm. Hmm.
so systematically, you have not mapped the funnel, that what happens
Correct.
when the patient dials an emergency number, say, let's
Hmm.
call it 911 for the
Yeah.
fun's sake,
Yeah.
and till the time he's triaged in the ER.
Hmm.
There are so many steps that happen during this funnel.
Correct. Hmm.
You have not put in effort to understand that, whether the logistics of getting an ambulance to the patient is a problem, or from the pickup point to the ER, sorting that out, collaborating with traffic movement and everything,
Yeah.
that is a problem, or triaging and getting the right specialist, right nurse in the department is a problem. You are
Hmm.
not mapping it. You are just
Correct.
thinking that I know the system and let's go
Yeah.
ahead. Bring in your doctors.
Correct.
Don't bring the tech people. Tech people will design. So I'm
Hmm.
not a technician
Hmm.
in my role. So I
Yes. Hmm.
don't know how to code. I can't even open a
Hmm.
Python and write any simple code. I can't do that. I can't do
Hmm.
SQL queries. But today my team has three or four data analysts, at least five to six data engineers, and
Hmm.
I talk tech to my clients all the day.
Hmm. Hmm.
Simply because I am there as a specialist. I talk to their doctors. I understand their problem. I
Mm.
think about the solutions that, okay, this is the bottleneck that I'm going to solve with my solution. And then I bring in my data engineer to
Yes.
craft a
Mm.
solution around it. And then that's how we do the business. It's not
True. True.
about, thinking from outside the system and saying that, okay, we will solve a problem.
Yeah.
And
Yeah.
in healthcare, if you don't engage with doctors, and
Mm.
trust me, I mean, Indian doctors, I have had so many examples. I can name so many people right now
Mm. Mm.
who can, outshine any tech person. I mean, they know what they want. They know the
Mm.
problem that they want.
Yeah.
I mean,
Yeah.
a classical example I will tell you, not Indian, but at the global level, in fact.
Mm.
So
Mm.
NHS in 2019 or 20, I think, no,
Mm.
later, 21, 22, they said that we have rolled out EMR 100%. And the
Mm.
total budget was 100 million pounds.
Wow.
So
Huh.
when I was doing my research for my dissertation, I said, okay, let's see whether, whatever you claimed for happened after that or not. So one side was the
Mm.
patient story, second side was, the physicians
Yeah.
who were working across this
Mm.
EMR rollout and everything. And my research clearly quantified it, in fact, that,
Mm.
the pressure, the work pressure of uh, GPs actually increased, and there were higher number of dropouts, and burnout rate was higher after EMR
Mm.
rollout compared to the before scenario
Yeah.
when
Yeah.
they were doing the regular paper thing. And
Correct. Huh.
a physician is now spending more hours per week
Mm.
on non-clinical work, doing the EMR filing and everything,
Yeah.
as compared to the time with the patient, and that's why the patient outcomes are also now dropping off.
Oh. Wow. Huh. Huh.
So, that's the classical case when we design something where we
Yeah.
don't listen to the doctors, because they are the
Correct. Correct.
users, they are the consumers. I
Yes.
mean, even if it is a patient-oriented solution, have you done your market research?
Yeah.
And
Yeah.
from the global perspective, when you are
Mm.
developing your solution, when you are defining the problem, have you done that research on the global platform, not on an Indian
Correct.
platform? I mean, India
Correct.
can be
Correct.
your incubation center, but you have to take
Yeah.
it to the global market at some stage. You can only grow to a certain percentage in the Indian market. You have to tap in
Mm.
when it comes to healthcare specifically.
Correct.
There
Huh.
is a
Correct.
very simple logic that I always tell. You have to always
Mm.
go global in healthcare, simply because people in India are spending money on healthcare from their own pocket. It is not
Yes.
sponsored. So you are
Yeah.
limited by the amount of money that you can charge to the
Correct.
patient or to the
Yeah.
system. But in
Yeah.
global markets, it's a funded ecosystem. So there,
Yes.
if your solution is worth the solution, worth the
Mm.
problem, then you can charge as much as you want, and people are ready to pay for it. But in India,
Mm.
even if you, create, say, a miracle drug for cancer treatment, can you charge
Mm.
a patient for 10 lakh rupees a month for one cycle? You cannot.
Mm.
But in these
Mm.
systems, you can, if you can prove the worth. You have
Correct.
your genetic therapies, you have your other therapies, stem cell therapies, and everything.
Yeah. Yeah.
They are charging phenomenal amount. But
Correct.
in
Correct.
India, you cannot even dream of that. So
Yeah.
you
Yeah.
have to go global. So start thinking global on day zero. Why not?
Correct. I'm adding one point over here. Coming back to again like Indian mindset, right? We're a middle class society. I come
Yeah.
from a very very humble background, and we have this conservative mindset, right? So I'll give you example. You talked about stem cell therapy. So
Mhm.
there is one company I'm trying to work with them, trying to raise funds. It has a very long gestation time, right from your in vitro. Scientists are excited. We know the globally it is happening, but right from a thought to IND, forget about phase 0, phase 1 and all. It's going to take lots of time. And
Mm.
then, but the outcome will be mind blowing. Like if we are able to come up with one IND, you can imagine the exit or the kind of revenue that company can have. But then not as very, I don't know, I should not claim it, but I don't see a tendency towards investing into such kind of companies. Whereas such companies are heavily funded outside India. Whereas in our country it is not. Is it that is our mindset that is limiting us? That I play very safe. Okay, or I will invest only when I have exit in 3 years or 5 years. That's the mindset, and that's probably pushing the technology to think in a very narrow way and only for exit, and not thinking of how I can build something and take time to build something that can have application at a global level.
Yeah, very truly said. In fact, that is the problem of the system. But that also
Hmm.
originates from the system itself.
Hmm.
As I was earlier talking to you about thinking of global, expanding it to the global, as an Indian and born in a typical Indian household, you are
Hmm.
born and brought up in a risk-averse scenario. Your
Yes.
risk-taking ability is almost zero,
Yeah.
right? And unfortunately, that same mindset you can see in our investment patterns.
Hmm.
We
Hmm.
don't want to invest in future. We want
Yeah.
to invest in present. Our
Hmm.
benchmarks are, IRR that other investments have generated from other sectors like banking, defense,
Hmm.
consumer markets and all that stuff. The DNA of healthcare is very different.
Hmm.
And unfortunately, the way investments have flown in and the way the whole ecosystem is built, it supports
Hmm.
the output. It doesn't support the outcome.
Hmm.
You know, I- 2017, I went to Bangalore. Dr. Tarif is there. He runs the incubator there, the government-sponsored incubator. I'm missing the name of the incubator. And there was this
Hmm.
company called Bugworks. It was
Hmm.
run by three scientists. And
Hmm.
it was the time when AMR was picking up. For the first time, I think it was called as an pandemic by WHO and G20, and then it became a global sensation that we need to solve this
Hmm.
thing.
Hmm. Yeah.
And India at that time, when the government shift has also shifted by that time, and Modi ji had called about for total eradication of tuberculosis in India.
Hmm.
So I was very curious. I wanted to understand whether is it possible for us to eradicate tuberculosis by 2025, which the data has
Hmm.
obviously passed, and we are still struggling with it.
Hmm.
And I went to this company and wanted to understand how do we solve for MDR, the
Hmm.
multi-drug resistant
Multi-drug resistance. Huh?
tuberculosis,
Hmm.
because that is a big problem in India.
Yes. Hmm.
We have so much resistance on this thing. And this guy tells me that, this one of the founders, he tells me, see, in this lab, we have found a solution. We are in phase two of development.
Hmm.
We have found a new antibiotic which
Hmm.
actually is more sensitive to even to the superbug and has
Hmm.
good results. We have
Hmm.
published the paper, we have done everything, but the only funding and support we are getting right now is from the government, which has given us this incubator to set up our lab, and
Yeah.
we will take forward the solution. And if we hit our phase three milestone, then
Hmm.
we can expect some funding to come in from global pharma again
Hmm. Hmm.
or from pharmaceutical industry. But
Yeah.
there was no VC, no
Hmm.
PE scenario that he was even thinking about.
Correct. Hmm.
And that is the mindset that actually hits hard when
Yeah.
we say that we are not outcome driven, we are output driven.
Hmm. Hmm. Hmm.
That's the unfortunate part. But yes, some stage, people have to realize there. In fact, global investment funds are realizing there is Quad, which is a
Hmm.
purely healthcare fund. Then
Hmm.
there is a spin-off of TPG. I
Hmm.
think it's led by Vishal Bali, and it's called
Hmm.
Triple A. These guys are
Hmm.
focused. They have big purses, right?
Hmm.
They
Hmm.
are
Hmm.
focused on healthcare. They are a healthcare
Hmm.
focused funds. But even if
Hmm.
you look at the investment style or investment themes,
Hmm.
they are investing in growth stage companies.
Hmm.
That's where the problem starts. If
Correct.
you don't create that pool of
Hmm.
solutions which are going to
Hmm.
give you the kickstart or the rocket start. Even you and me, we are also investors. We invest our money, right?
Hmm.
We always balance our portfolio. You
Yeah.
know, there is a certain part of small cap on which we take a bet, an
Hmm.
educated bet, but yes, we take a bet, and that
Hmm.
can either skyrocket or that can fall flat on its face. But that appetite has to be
Correct.
built somewhere. The
Hmm.
government has tried to do it in India by
Hmm.
providing an initial uh,
Grants. Hmm.
funding, grants, and all that
Hmm.
stuff, but it is not enough. Healthcare
Yeah.
is a costly affair,
Hmm.
and private equity needs to flow in there. Private
Yeah.
equity needs to realize that, okay, probably this might not kick off,
Correct.
but need to support that environment for that innovation to come out. We have so much data. We are
Mm-hmm.
sitting on piles of data. I mean, forget about data. Think about clinical
Mm-hmm.
trial industry. Why did the CRO and CTO industry boomeranged in India? It was simply
Mm-hmm.
because of this reason.
Yeah.
We didn't had a conducive regulatory framework at that time when CROs and CTOs CMOs were being developed,
Mm-hmm.
and money never flew in. I
Mm-hmm.
mean, people started their businesses, they had to shut shop because they were bleeding money. In fact,
Mm-hmm.
I will tell you example from my own life. So in 2015, I rolled out a venture called We Care Venture. My idea was to take out the doctor. I mean, I we were trying to solve for last mile access, and we
Mm-hmm.
thought that probably we can partner with governments and set up a shop in a post office or somewhere wherein we will collect routine clinical parameters on primary
Mm-hmm.
healthcare. For example, your BP, your temperature, your weight,
Yeah. Yeah.
your heart sounds. So we will
Mm-hmm.
do this online. I mean, we can capture this online and transmit it to a call center where there are university students, final
Mm-hmm.
year or interns sitting and analyzing and providing guidance for them to either to go to the secondary care hospital or get a basic treatment. So the prescription can be written and an automated ATM machine can dispense the medication. So we had
Mm-hmm.
uploaded the 70 essential medicine list
Mm-hmm.
in that machine, and it once the prescription is generated, it will dispense the right amount of this thing. So it was a system, I truly believe, till now ahead of its time, but it was solving a problem.
Mm-hmm.
But the problem was that I was not getting any funding.
Mm-hmm.
Wherever I went, they thought that this will not fly, this will not
Mm-hmm.
be required. And I had to shut shop because I was burning my own money
Yeah.
a lot.
Yeah. Mm-hmm.
Within 1.5 years of all the development and everything, setting up the whole ecosystem, I had to shut shop. But
Mm-hmm.
had I sustained it till COVID 2019, just 4 years down the lane,
Mm-hmm.
that startup would have got all kind of grants in the world,
Correct.
would
Correct.
have got all kind of acknowledgements.
Yeah.
So, I mean, that's the problem with the startup ecosystem. I mean, the
Correct.
funding is
Correct.
ecosystem. It's safe growth,
Yeah.
and in healthcare there is nothing safe.
Correct.
You have to test out. You have to
Yeah.
create
Yeah.
that R&D bucket and take the risk.
Hmm. Yeah, there is one thing I truly feel about the government grants that are available, that it should totally reserved for. Okay, and I'm like, probably thank God I'm not a policymaker because I'll make a very strict policies then. Is it should be totally reserved for organizations or innovations that require a longer gestation for research. Okay, it should not be allocated to the companies, those who need just for small little R&D. It's a tech solution and other things. Core research requires support from the government, and there should be grant that should be completely reserved only for these organization. And they should have a support from people like you, those who say that okay, this is the R&D, but will help you to mature it in such a way that now it's ready for VC and other, but then till then the support system should be there. Whereas I feel the grants are available, but those who are applying are open category, right? Like anyone can apply for it, irrespective of whether the
No,
funds are required only for research or not.
beg to yeah, I'll beg to
Okay.
differ on
Huh.
that. I mean, the government actually tried to do something similar. So when they
Huh.
had set up that incubation centers in Bangalore, Andhra Pradesh, there was a medtech park that came in
Yeah, yeah.
Andhra Pradesh. There was one in Gujarat came in. So it was aimed at building the R&D capability. So there
Hmm,
were
hmm,
special allowances, tax holidays, and the expectation was that the leaders of the market would support and would probably create opportunity for
hmm,
these new solutions to be incubated in Indian scenario, and probably India would become the innovation lab.
hmm,
So earlier we were talking about India as a pharmacy lab, but then I think 7 8 years back, the present government changed the narrative that
hmm,
we will
hmm,
become the incubation hub of the globe.
hmm,
But
hmm,
unfortunately, see, there are systematic challenges around that as well.
hmm, hmm,
So if you look, I mean, if you talk about different segments, say for pharmaceutical development, though we have a huge number of pharmacists graduating every year,
Hmm.
but are they globally competitive? That is the
Hmm.
question.
Hmm. Hmm.
So can they carry out that research?
Ah,
So
hmm.
that creates an element of doubt in the mind of investor as well.
Correct, correct.
Should
Huh.
I set it up here, or
Hmm.
should I set it up in a global university or a international university which has all the right elements, has the
Hmm.
infrastructure, has the skill set, has the professors to guide that?
Hmm. Hmm. Hmm.
So right now we are in a mesh of unfortunate deficiencies across our skill set. If you talk about purely numbers, yes, you will find it is phenomenal. The
Hmm.
amount of number of doctors we are producing, the
Yeah.
amount of number of pharmacists we are producing, the
Hmm.
nurses that we are producing. But are they globally competitive?
Hmm.
That is the question.
True.
Then culturally, we are very diverse and sensitive.
Hmm.
So whatever solution we are bringing to the market, is it going to fly? And then there is a continuous, unfortunate nudging from the political scenario as well,
Hmm. Hmm.
and the red tapeism typically. I still remember, I was having a conversation with a doctor uh, in Vadodara. She was a railways doctor, and there the problem was snake bites. So there were so
Hmm.
many snake bites, and she kind of did her own research, set up her own lab, did some stem cell manipulation,
Hmm.
and her results were very good. Whatever
Hmm.
solution was, I mean, I don't have the details at top of my head right now. It was probably 6 7 years back. Results were really good,
Hmm.
but when she went to get an approval for that to the presiding body, I
Hmm.
mean, I can name the person who she went to, but let's not go there. So they just uh, they just denied
Hmm. Hmm.
because it was not done in proper clinical setup. Why? I
Hmm.
mean, my question was, at that time I went and I tried to lobby for her, and
Hmm.
I simply asked, why.
Hmm.
If you want clinical trial results, give her the
Hmm.
platform. She has a good product in the market. Don't kill the
Yeah.
product.
Yeah.
Why you are killing the product?
Hmm.
If you
Hmm.
want to support the product, just give her an incubation lab, let her run the trial in a controlled
Correct.
environment,
Correct.
prove results, and go global from there.
Yeah.
You
Yeah.
will create a unique product from the country. But
Hmm.
no, the
Hmm.
mindset was not.
Hmm.
Again, the red tapeism is killing innovation in our country.
Yeah. Yeah. Venture, the funding ecosystem or regulatory environment, the mindset, these are all internal factors. Okay. Hypothetically assume that there is one organization who's listening to our podcast, and then we say that, okay, from day zero, I have built something which is globally applicable. I want to go global. Okay. I want to do it. Okay. And they have done it. But what are the external factors? Are there any barriers that will not allow this technology to actually go global?
See, one of the biggest barriers that I've seen, specifically in context to India, is that there is a big difference when it comes to regulatory compliance.
Hmm.
For example, GDPR. Let's talk
Hmm.
about GDPR. Globally it is an accepted standard,
Hmm.
but in India it is a good to have standard.
Hmm.
It's not an enforced standard,
Correct. Hmm.
right? And that's where the challenge lies,
Hmm.
because we are not globally compliant.
Hmm.
We need substantial amount of investment. So the way cycle works is, you build a solution in India. You have
Hmm.
invested your hard earned or your initial wallet into you have poured everything in there. You have taken the company to a scale, but in that model you forgot to bring in the global elements. You
Hmm.
did not do your market research on global, whether the problem is
Hmm.
truly global or not. Your solution doesn't addresses cultural variances or doesn't acknowledges cultural variances. Then the
Hmm.
regulatory challenges, you have not built in that governance in your framework.
Hmm.
Now, say 5 years down the line, 6 years down the line, which is an average period of time when a startup starts thinking about, I had the success in Indian market, let's go global. So when
Hmm.
you are moving that movement, you are 5 years, 6 years down your journey, you have burned
Hmm.
almost like say 10 to 15 CR of your initial bootstrap or whatever funding you had.
Hmm.
You have started churning out revenue, and you are a bit of positive. Now,
Hmm.
what is the incentive for me to invest reinvent the wheel, because that
mm,
wheel doesn't needs to be reinvented. Because at the beginning I did not think
yeah.
about GMP, I did not think about GDPR, I did not think about sunshine, I did not think about any regulatory compliance that would be required if I go global.
Mm,
So that's what, even in the beginning of the podcast, I was talking about.
mm,
If
yeah.
you want to go global on day zero.
Mm,
Otherwise,
mm.
say that I am an Indian company, I will stay in India and I'll make it successful in India. That's a
Okay.
perfectly fine
That's
storyline.
perfectly fine. Yes. Yes.
If you have that ambition, think it on day zero that this is
Mm,
happening, this is going to happen on
mm,
year five or year five plus T, whatever it is.
mm,
And
mm,
so, what I need to do today, can I make it
mm,
compliant today? Otherwise,
mm,
the
mm.
cost just exponentially increases, and then nobody is ready to invest.
Correct.
It is
Correct.
very hard to convince the stakeholders, because
Mm,
again that
mm,
risk averse mindset is there. You are exploring a new market. Even before generating $1 out of that market, you are asking about investing a lot of your hard-earned money. So
mm.
nobody gets convinced to that story, right?
Correct. Correct. No, but we still have, if not all, many, but we still have few success stories. Okay, so non-clinical way, Zoho, they are able to do good. And in clinical, this Cure.ai, Practo, or we just talk about Ultra Human, these companies, they have, I won't say that global, but still Middle East. There are many companies, those who are able to get into Middle East, market. Now, what worked for them? Is it just the funding? They were funded and that's where they were able to
Practo
go global?
timing.
Ah,
So not the product,
hmm,
timing. Zoho is one classical example that I would love to talk about, because
hmm,
Zoho is a company which has managed its top line, bottom line, its expansion to global. The guy thought of global on day zero. He
hmm,
knew what he wanted to make,
hmm,
and
hmm,
he knew what the systems are deficient about across the globe. He studied each and
hmm,
every CRM solution, each and every project management
hmm.
solution, each and every enterprise solution that was available in the market, and that's where he
Mm,
created Zoho. So
yeah.
Zoho is an asset light, operationally efficient, lean company which is giving you a cloud that is scalable and sustainable. And those are the key
Mm,
elements: sustainability and
mm,
scalability. If
correct. Mm,
you can't provide that service, and you cannot be a solution provider, if your
mm,
system breaks, you, you lose the client. If you
mm,
can't
mm,
ingest the size of your client, then you lose value in the market. See,
mm,
the
mm,
problem in Indian startups is that we try to compete on price. हमें पैसे मांगने में ना, I'm sorry I'm using हिंदी, but हमें पैसे
mm.
मांगने में थोड़ी सी हिच होती है.
Yeah. संस्कार बीच में आते हैं.
हाँ,
Yeah.
exactly. So we don't understand the value that we are able to generate, or we will be able to generate, and then
Yeah.
that risk averse nature of ourselves takes over. That let's not invest.
Yeah.
We
Yeah.
are doing good.
Yeah.
We will slowly scale up. Why?
Mm,
I mean, look, though Babylon is a very bad example to talk about because they tanked like anything. But look
mm,
at the buzz that they created for the time they were there in the market.
mm,
They had everything.
mm.
They were everywhere. They were ready to invest. They saw an opportunity, they invested in an
Mm,
opportunity.
mm,
Yes, in diversification, they also took a lot of big risk, which led to their
yeah.
downfall. But
Mm,
yes, they were there. They were not spending on marketing, telling people
mm.
that, we are so. They were investing in real things, tangible things. And
Correct.
that's what Zoho has also done. Right
Mm,
now, if you go around Saudi, I've not seen, apart from few jewelers
mm,
from India, and not seen any Indian company having a billboard. I've been
mm,
here in this place for 1 year.
mm, mm, mm.
Zoho has it, and that
Okay.
too in Arabic, with a
Mm,
person with a figurine in Arab traditional dress. If I log into Zoho, so one of my email IDs is also on Zoho. If I log in it from here,
mm,
sitting in Saudi, I will not get the English. I mean, I struggle to find where do I translate it to English.
mm, mm.
It's all
Wow.
Arabic. They
Wow.
are so culturally sensitive.
Yeah.
They pick it up the right. They have picked up the right places. They have picked up the right clients. They have identified. And one of the more key things is they invest in their clients.
Hmm.
which is again one of the key success factors for them. They do
Hmm.
a proof of concept or POC. They understand their client. They read their systems,
Hmm.
and then they go global. I
Hmm.
few couple of years back, I was selling patient engagement solutions and CRM solutions
Hmm.
for
Hmm.
our client. We
Hmm.
started that, we will do the POC, we'll understand your patient funnel, and then we will custom make your solutions. But
Hmm.
as we started getting a couple of clients, we started asking money for POCs,
Hmm.
and that's where everyone lost interest in us. It's a very classical case, simply
Yeah.
because there are so many solutions available, similar solutions available in the market.
Hmm.
If you cannot custom make it, or if
Hmm.
you can't make it culturally fit to the organization, people
Hmm.
now have started talking about culturally fit to the organization. Forget about the nation, and we are still solving for the nation. So
Hmm.
that's what we need to understand, that if we are taking anything outside,
Hmm.
first increase our risk appetite. We have to increase our risk appetite. We have to invest where
Hmm.
we have to put our money where our mouth is. Offer something on the table. It's not the
Correct.
price.
Hmm.
Price, if your solution is great, you can charge a premium and everyone will pay for you.
Hmm. Hmm. Hmm.
Why do we try to compete on price? I have failed to understand over a
Yeah.
period of time. Build a
Yeah.
solution. You can charge X amount of money,
Correct.
but
Hmm.
yes, offer a tangible benefit, quantifiable benefit.
Hmm.
Don't paint a picture which is not achievable.
Yeah. Yeah.
Interestingly, there was a problem that we were solving here. Uh,
Hmm.
so apparently, there are teenage boys or girls who are ordering food, unhealthy food from food
Hmm.
apps.
Hmm.
So now they need, and which will eventually lead to an unhealthy lifestyle and
Correct.
unhealthy, a burden on the healthcare system.
Hmm.
So there needs to be a policy around it.
Hmm.
So, interestingly, if you look at this domain of the problem, it's a big solution opportunity
Yeah.
for a lot of players in the market.
True. True.
It's a behavioral management
Yeah.
problem case. And
Correct.
I had word with at least 3 to 4 Indian innovators who are in my network, and I said, how can we solve this problem? I
Hmm.
had a framework in mind from the policy side. I
Hmm.
shared that framework with them, said that this is what I think should be this. Now, what solution can we what, and
Hmm.
can it integrate with food delivery apps globally?
Hmm. Hmm. Hmm.
Unfortunately, nobody is even thinking about it.
Yeah.
And
True.
the best intervention, for example, recently Zomato did one small part of it, saying
Hmm.
that okay, we will give the calorie count of each and every dish that is there. But
Yep.
how does it solve this problem?
Hmm.
Is that the solution? Because the one who's ordering, until and unless he or she has an understanding of the nutrition data that you're presenting, what
Correct.
does that
Uh-huh.
number means to him or her?
True.
They will
True.
order what they want to
True.
order. It doesn't solve anything,
Yes.
and
Yes.
that's where solutions fail. You have to think
Yeah.
deep. You have to go systemic. You have to find the
Yeah.
problem origin. The systems
Correct.
are thinking. I mean, I love the way policymakers here think.
Uh-huh.
They just pick up a problem. They go deep into they start ripping about the structures,
Hmm.
finding the core of the issue.
Correct. Correct.
The core is identified. The policymaker is identifying the core for you. Now go
Hmm.
and build a solution. That's the market opportunity for you.
Yeah. Nice, no?
Yeah.
Nice. Yeah. Zomato should just add a mandatory BMI, and then it should give a pop-up by saying that you have ordered more than your recommended calories for the day. It'll
So,
be so hilarious.
there are so many things that can happen. If
Yeah.
say a
Yeah.
kid, I mean, I had designed a framework called Healthy. It has
Hmm.
6 or 7 stages and
Hmm.
different kind of interventions. If say my kid is ordering without my knowledge, is ordering a burger, a cheeseburger,
Hmm. Hmm.
what stops the app to send an alert? Hey, your daughter has ordered a cheeseburger.
Correct. Huh.
Yesterday she ordered a Coke.
Yeah.
Now I know. Now as a parent, I have a control,
Correct. Correct. Huh.
right? In your televisions, for example, if you go to any app or anything, you have this parental control,
Correct.
right?
Correct.
Nobody challenges that parental control. Everyone
Yes.
appreciates it. So what
Yes.
stops you in a food delivery app to do that?
Yeah.
Send me that nudge. I will be obliged to you. I will subscribe to you because you are sending me that nudge,
Yeah,
right?
you'll pay
So
premium for that.
exactly. I mean, I mean, it's a dollar value for me because if I can save my daughter from ordering unhealthy food all the time, that
Hmm.
means I'm also building her character. I'm also investing in her future. I'm also making sure that she's healthy all the time. She's eating healthy. That behavioral management is coming out.
Oh, so interesting. Uh, you are actually solving the problem, right? And you're lucky. You are very lucky that somebody is giving you a problem and you get the opportunity to actually solve that problem. That's like a
Hmm.
dream of people like me that, oh, I'm solving the problem. Um, Tell me one thing, that with all your years of work, knowledge, and so many, I mean, my goodness, like you had your own startup and now you are helping other startups, investment, everything. Assume that hypothetically again, that you get to redesign the ecosystem of India. What do you think? What you will change over there?
First thing is the mindset transformation.
Hmm.
From building fast, we need to go for building a legacy,
Hmm.
sustainable, scalable legacy.
Hmm.
Then, if I'm saying that I am global, a strong focus on global on day zero.
Hmm.
Understand what the problem is and whether it is a universal problem or not,
Hmm.
and then decide whether then set up your vision and mission statement, whether you
Hmm.
are going to stay in India or you are going to go abroad.
Okay.
Then the governance and the ethics part of it.
Hmm.
You
Hmm.
know, if you are decide to go global,
Hmm.
be ethically compliant, be regulatory compliant, be export ready on day zero.
Hmm.
There is no shortcut. You cannot do it 5 years down the line. You
Yeah.
cannot do it 10 years down the line.
Hmm.
You have to do it today because that is a cultural thing.
Correct.
It's not something that you build. Okay, I have called in an ISO audit and
Hmm.
now I'm an ISO compliant. No, that a certification doesn't make you ISO. I mean, globally compliant.
Yeah.
You have to build that as a culture in your organization.
Hmm. Hmm.
And then from the policy side, there needs to be big shifts that we should expect. I mean, there should be platforms like sandboxes,
Hmm.
you know, be participative, explore those opportunities. Everyone is talking about even India, IRD for that matter. In fact, I remember back in the day, were having a discussion with IRDA, and IRDA has rolled out a proposal to set up a sandbox.
Hmm.
At that time, six private healthcare insurance were present in the market. And
Hmm.
I don't think so, not even three or four subscribe to that sandbox. Why?
Wow. Hmm. Hmm.
You have an opportunity to create a product. Go
Hmm.
in, invest in, and do
Correct.
the product development. So
Yeah.
that development, so we have to bring in that product development mindset.
Hmm.
Operations is fine. We have come out of that age.
Hmm.
Probably operational management was good in late 90s, early 2000. We are done with it.
Correct.
Now the world is moving out. AI is taking over operations. Everything
Hmm.
will move into
100%.
automated functions.
Yes, it is.
There is nothing to manage now. So
Hmm.
grow out of that, start developing products and make it, patient centered.
Yeah.
Think about outcomes. Don't think about output.
Correct.
Output is not the value. Outcome is the value.
Yeah. Yeah.
And that's where you build the ecosystem maturity in your system.
Oh, yeah. I don't know how many years it's going to take, but because it's like a complete shift. Sometimes I believe that
Yes.
there is a parallel universe that exists, and then somewhere in the other Earth or some other, universe, probably this is how it is happening. I
No,
hope
it will
that's true.
happen in India. It will happen in India. See, India missed the train. Definitely,
Hmm.
our policies and everything were not conjugate to our global expansion.
Yeah.
We missed that train, but now with tech dissolving the borders,
Hmm.
and it's good, like events like what the great President Donald Trump has done. I
Hmm.
mean, the H1B. There is an inflow of talent coming back, and
Hmm.
this talent pool is the opportunity actually, because
Correct. Correct.
they have transitioned from operations to product development.
Yeah.
Now they are coming back. So
Yeah.
they will create what was missing in the
Perfect.
Indian ecosystem. And let's hope in 10 years we will be talking about how India is winning over the world rather than
Yeah.
what India needs to
Yeah.
do
And do you think
to
it
win
is
the world.
possible? Like, you think there will be any Google from India or Tesla from India? or like
Oh
in place of only
yes.
Sundar Pichai from India?
No, we will stop exporting. There would come a time when we will stop exporting talent and start
Hmm.
building companies and start exporting products outside.
Hmm. Hmm. Hmm.
But yes, for that transition to happen, we all need to come out and think beyond the borders.
Hmm.
Right now, we are too overwhelmed with 1.4 billion population numbers, thinking that it is a big market. No, it is not a big market.
No,
Let's
it's not.
realize
No.
it. It's a very small market which has small consumer appetite,
Hmm.
and let's start thinking and let's start merging that, because once this segment of the market merges with global, then your next segment, which is the largest segment, your middle class, will
Hmm.
start earning and start spending, which will create another market. So it's a transition phase. But yes, truly said, we will have our own Apple, we will have our own Google, probably better than Apple and Google's. Probably next time we will be talking about an Indian startup which is a benchmark for global
Correct. Correct.
companies. But that
Yeah.
will happen, and hopefully, with all this talent coming back to the country, we will see products which will challenge the global markets. Right now, we are not
Correct.
challenging the market. Let's challenge
Yeah.
that
Yeah.
market.
But do you think even if it will happen, will it happen in healthcare sector?
That is a long shot, because right now we unfortunately our healthcare system is way behind. I
Hmm.
mean, things I have seen here, things I have seen in UK. I mean, though I don't benchmark UK, that system has its own challenges.
Hmm. Hmm.
So those opportunities needs to be created at system level, and then yes, and it's something from the innovation side also. People need to start thinking about uh, challenging the market rather than complying with the market.
Hmm.
Let's
Hmm.
not be compliant with the market. We are
Yeah.
Indians, we have always disrupted the world whenever it was required. So let's disrupt healthcare market for
Hmm.
once, and show that if we can manage 1.4 billion, then we
Hmm.
can manage the rest 6.5 billion remaining in the world.
Hmm. Amazing. Yeah.
Yeah,
Oh my goodness. We just started with why our tech doesn't travel. That was the question I asked. But I didn't think that I was not expecting that this conversation will be so candid, so thorough and honest and pretty inspiring to me actually. Me and my co-founder Dr. Kavya, we are trying to build NXT Health, and in that's the gap. We are like, okay, let's start somewhere. And
right.
podcast is the way where I am so lucky. I'm able to talk, listen to all these things, capture this whole information and distribute, because that's where the whole information is available. It's not there on ChatGPT. So I am so thankful to you. I'm so thankful to you. My team will be very, very happy.
Anytime, more than welcome. Lovely to chat with you. And definitely, I mean, see, until and unless we collaborate, we cannot create a bridge, right? We all have our own experiences, and hopefully, we are able to help our or add our bit to that bridge where India becomes a dominant position, takes a dominant position in healthcare. I'm more
Yeah.
than happy to talk to you always, and it is a pleasure to be here.
Perfect. Thank you.